to President Biden for clean energy innovation and implementation at the White House. He is the founder and former chair for the Washington, D.C.-based think tank Center for American Progress and a founder and former chair of the Washington Center for Equitable Growth. John Podesta served as the counselor to President Barack Obama, where he was responsible for coordinating the administration's climate policy and initiatives. In 2008, he served as co-chair of President Obama's transition team. He was a member of the UN Secretary General's high-level panel of eminent persons on the post-2015 development agenda. He previously served as White House Chief of Staff to President Bill Clinton. He chaired Hillary Clinton's campaign for president in 2016. A Chicago native, he's a graduate of Knox College and Georgetown University Law Center, where he's a visiting professor of law. We are so grateful for your comments today.
I don't want to interrupt your lunch, so keep eating. And I will try to be relatively brief, give you some high-level thoughts, and then Lisa and I will get into a bit of a conversation. It's good to see my friend Bill Novelli here. It's great to be with you here. And let me start really with just a big thank you for not only engaging on climate from an academic and from a medical practice perspective, but for supporting your most vulnerable patients in the face of a multitude of health challenges that, of course, include the adverse health consequences that are the result of poor air quality, as well as other stressors that are the direct result of climate change. When a hurricane hits, you're the first responders making sure people are safe and serving your communities. You're the ones helping your patients deal with asthma, with Lyme disease, other health conditions that are linked to air pollution and climate change. And you're the ones who see firsthand how social and economic factors can influence the health of people in disadvantaged communities, like the fact that Black Americans are 34% more likely to live in areas where childhood asthma rates will grow the most due to air pollution. Hispanic Americans are 43% more likely to live in areas where people are having to miss work because of extreme heat. And American Indian and Alaska Native individuals are 48% more likely to live in places most vulnerable to sea level rise. To all of you, these are more than just statistics, of course. They're your patients, your neighbors, your family members, and the escalating impact of the climate crisis are already taking a toll on their mental, their physical, and their emotional health. As President Biden and Vice President Harris know all this too well, and that's why we're making historic investments through the Bipartisan Infrastructure Law and the Inflation Reduction Act to improve health outcomes for underserved communities. Obviously, the IRA had direct impact on healthcare policy, like lowering the price of insulin for Medicare recipients, which has resulted in lower price for other populations as well, as the pharmaceutical companies have seen fit now finally to lower the price to $35 a month for nearly all patients now. But the clean energy provisions of the Bipartisan Infrastructure Law and the Inflation Reduction Act will have profound effects on improving the health and lives of Americans as well. We're bringing electric school buses to communities across the country so kids can breathe clean air on their way to class every day. We're replacing every lead service pipe in the nation, cleaning up PFAS chemicals so every family can drink clean, safe drinking water at home. We're upgrading the electric grid to help keep the lights and heat on during extreme weather events. We're making clean energy affordable and accessible so more Americans can eliminate harmful pollution in their homes and their vehicles. And we're on track to reach 80% clean power by 2030, a goal that President Biden set during the course of his campaign. On track actually to reach 100% clean power sector by 2035 on our way to a net zero economy by 2050. All of that will reduce air pollution and help prevent up to 18,000 deaths through 2030. President Biden's new laws are really total game changers, but it's one thing, of course, to pass a law, and it's another thing to implement it. We need to make sure That's why I came back I failed at retirement. I'm back. President asked me to come back and try to work on the implementation of these relatively profound and complex provisions that cover everything from clean energy to clean transportation, clean buildings, clean manufacturing, more investment in climate smart agriculture and forestry. We may need to make sure that these laws deliver maximum impact for human health. And to do it, quite frankly, we need your help. First, we need your help spreading awareness about these new programs and connecting your patients to federal resources. For example, low-income home energy assistance program, LIHEAP, for those of you who are into that business, helps hardworking families afford to keep their homes warm in the winter and cool in the summer. The Department of Energy's weatherization assistance program help families make upgrades to their homes to make them safer, more comfortable, more affordable to heat and cool. And the Inflation Reduction Act is expanding access to health benefits of clean energy. Your patients could take advantage of tax credits that slash the cost of electric vehicles, heat pumps, and other clean technologies. And soon this fall, they'll be able to get upfront rebates on clean technologies, including induction stoves, which cut harmful pollution at home. Those rebate programs, which will be run by state and tribal governments, will be able to offer these technologies at reduced cost or for free in some cases to low-income families. Second, we want to make sure your hospitals take advantage of federal opportunities to show leadership on climate. Hospitals often have a large carbon footprint, and you can be early adopters of the latest technologies in energy efficient lighting, air conditioning, heating, and ventilation. The White House and HHS launched a healthcare sector climate pledge to match the Biden administration's climate targets to cut emissions in half by 2030 and reach net zero by 2050. So far, over 100 hospitals, health systems, suppliers, group purchasing organizations, insurers, pharmaceutical companies, and more have signed that pledge. The signatories represent over 830 hospitals, and combined with the federal health systems, the VA, the Indian Health Service, and others, the defense health systems that have made similar commitments, more than 15% of American health facilities have rallied around our national climate goals. We want to see that number grow. So we just reopened the pledge. For those of you who wish you had signed up earlier, we just reopened that pledge last week, and we encourage you to sign on. If you sign the pledge by April 12th, you'll be recognized in an announcement on Earth Day. If you sign the pledge by November 1st, you'll be recognized around the UN Climate Conference, COP28, by December. As healthcare organizations, you can also join the Department of Energy's Better Climate Challenge to learn and share with your peers and move to net zero faster. The third way I think we can work together is by supporting healthcare facilities and professionals providing critical services during and after climate-related disasters. We're already seeing examples around the country of leadership here from the Texas Medical Center in Houston, which updated its infrastructure to withstand flooding and continuing to serve the community during Hurricane Harvey, to community health centers in Puerto Rico that have installed solar panels and batteries to keep the power on during future storms, to the solar-powered Crescent Care Health Center and Resilience Hub in New Orleans that provides critical services during extreme weather. HHS helps equip public health departments for emergencies like climate-related disasters, and the Department of Energy has published a guide for healthcare facilities to enhance their energy performance and resilience, which can help them better serve their communities during a disaster. And across the government, we're committed to providing more technical assistance and resources to increase climate resistance in the healthcare sector. That was something I think we first worked on in the Obama administration when Secretary Burwell, now the president of American University, had the leadership of HHS. But that's expanded, blossomed, and I think there's more and more information that we can pass along to you. We're eager to partner with you on all these opportunities, and that means we need to hear from you on how the government can best support your efforts as you protect your patients from climate risk. The Office of Climate Change and Health Equity at HHS is your front door for getting information, asking questions, offering feedback. The Biden-Harris administration created that office in 2021 to mobilize climate and health efforts across the federal government and with the health community. The office already has a list of federal resources that you can use to take action on climate, and they're preparing more resources in the coming months to help you take full advantage of the Inflation Reduction Act. Ultimately, we all envision a similar future, one where clean energy powers our nation and benefits every community, where children breathe cleaner air and drink clean water, where communities are resilient and prepared when disaster strikes, and where every American can take control of their own health. So let's help turn that vision into reality. We intend to be a good partner with you. I was talking to my friend Ed Maybeck as I came in, and he noted we worked together when he was here, of course, and I was at Center for American Progress, about how much more interest, inclusion, and investment there is amongst healthcare professionals in the climate issue and the stresses that we'll feel in the future. So as I said, we have resources. We intend to be good partners. We're looking to you not only just to upgrade your own facilities, but really to be a voice with your patients for what they need to do and how they can take advantage of these programs that we've just enacted. So thank you for having me here, and I look forward to a conversation with Lisa.
John, thank you so much for those comments. And I think you will find a very jazzed audience here about all the work that the Biden administration has been undertaking on behalf of climate and health. So we want to thank you. I think one of our first questions, and I think this is part of why you were brought in, is that both the IIJA and the Inflation Reduction Act are huge pieces of legislation, very complicated. And many in our health professional network would like to get more involved. But sometimes it's hard for us to know exactly where to begin or where to start. What advice would you have to us as advocates on how to best influence how these dollars are ultimately spent?
Well, let me start by saying the IRA is a little bit different than most federal legislation that you've seen passed, including different than the bipartisan infrastructure law, the IIJA, in the sense that an awful lot of the benefit from the IRA is working its way through the tax code. It's support for all those, for transitioning and innovating in that clean space that I talked about. So it is government enabled, but a lot of it is private sector led. It has an interesting feature for the nonprofit institutions in the room, in that normally tax breaks, tax benefits, tax credits are available to the private sector against their tax liability. In this case, nonprofits can take advantage of the provisions of the IRA through a feature that's known as direct pay. That was originally a slightly different version, was first done in the American Recovery Act that President Obama passed in early 2009. Which gives essentially a grant in lieu of a tax credit. So whether it's the private sector partners who are working with you as suppliers to your communities, or directly for nonprofit institutions, you could take advantage of those to transition your own facilities. In order to do that, we need your input. We need your help in understanding what challenges you're facing, et cetera. But as I said in my remarks, I think the most important space for the healthcare community is not just the direct public education, the public service you do when you're talking directly to your patients about the effects of extreme weather, how you can reduce air pollution, the benefits that you can get from these programs. And we're happy to work with you on guides to medical professionals and how they might interact with their patients on that, but also at the community level to create good plans to reduce the burdens that particularly in those communities that have often been left out and left behind, that have borne the brunt of both power sector and industrial pollution, that have are associated with heat islands in our urban communities. Your advocacy for smart planning, for good for good support at the city and town as well as at the state level is really, I think, going to be extremely important.
So this, for example, could look like a advocate showing up to either their local government or on the state level with their decision makers there to talk about how these dollars could be used towards climate resilient communities, for example.
Absolutely. The Environmental Protection Agency has notice, but will send at the end of the month money to every state, and as long as they raise their hand and want to accept it. Maybe there'll be a couple that don't, but so far we've been even like on the charging infrastructure that was in the bipartisan infrastructure law, the money for universal broadband. Even the most conservative states have said, "I'll take the money." So that's a little bit good news. A little different than the ACA and Medicaid. So that at least is good news in this space. But those grants are going out as planning grants to reduce greenhouse gas emissions to every state and territory, as well as to about 75 large metros. Getting into that planning process is another place that would be useful, because what the plans do is open up a $5 billion pot of project money to reduce greenhouse gas and other co-pollutants in that process. So for those of you who are active at the state level, working with the state energy offices, with your governor's offices, that's really a very direct place to say, this is what our communities are facing. These are the health impacts of what's happening as a result of extreme weather, and this is how you ought to spend those dollars.
I'm just curious here, how many folks here are from one of our state clinician groups? Yeah, so, and this is perfect advice, I think, for many of our state clinician groups really thinking about getting involved on that level as these dollars come from state to state. Another place, and you mentioned this in your speech, of where we as health advocates very naturally plug in is in our clinics and our hospitals. And so where would you recommend health advocates have their eyes or be on the lookout for in terms of how those IRA dollars get implemented for improved hospital and clinic resilience?
Well, look, I think there's the direct impact that you can take advantage of, those 30% investment tax credits, et cetera. There is additional dollars of tax support that go to purchase of electric vehicles, particularly for those systems that utilize heavy vehicles. That there's a fairly substantial credit for that as well. But I think everybody can do better in terms of increasing the efficiency of facilities, using rooftop solar where that's available, working with other community-based organizations in the process of building out community solar. And then I think, as I said, I think the direct support with patients, letting them know that these rebate programs are available, maybe having some literature in the clinics to help them take advantage of what's going on. Those are programs that will be implemented through states and tribal governments. They're federal dollars that are flowing to the states. But I think every state will take advantage of that. There's $9 billion in the pot for that. And then lastly, I think, particularly for people who are working in clinics and facilities in disadvantaged communities. I mentioned this, but the structure of this bill was kind of different. Normally, particularly in the tax code, and I've been around the track a little bit, so I think I can say this and nobody will challenge it. The support for the private sector comes in the form of wanting to incent the activity, but not necessarily incent the place where that activity might take place. The IRA is different. And it's different in this in the context that the tax credits that are available, again, whether that's power or buildings or manufacturing, get bonuses if you're investing in traditional energy communities, fossil fuel communities that are in transition, or if you're investing in disadvantaged communities, or the facilities are co-located with publicly supported housing. So places that where, particularly for those serving in those disadvantaged communities, being a partner with community-based organizations to be able to access that, think through the plans there, produce both cost reductions for people who are under, great economic stress, but also the public health benefits of having cleaner systems in the built space and in the communities. We're about to do $1.5 billion program on urban forestry to attack the problem of the lack of tree cover and canopy that creates what can be a 20% increase in the heat stress in poor neighborhoods versus, suburban neighborhoods in urban environments. Being aware of that, at least to some extent, again, particularly for people who are already engaged in community-based organizations. Sometimes the clinics themselves are the heart of what is the community organizing effort in the community. I think those are all really strong ways that, and that public health voice that, it's so credible. And maybe if I take a minute, when I was with President Obama, just to reflect back, we decided we were going to reduce pollution from, I think Gina McCarthy was here last year with you guys. So my friend and colleague, Gina McCarthy, who ran the climate policy office at the White House, was the EPA administrator. We did a major rule to reduce a power sector pollution called the Clean Power Plan. Where did President Obama announce it? That's pretty unusual that you announce a proposed rule, have the president do that. That's how important we thought it was. Where did we do that? At Children's Hospital with kids who were suffering from respiratory disease and asthma, and pediatric docs who understood the value of cleaning the air on the health of the citizens, of the kids that they were serving. I mean, that is a very powerful story that needs to be told over and over again around the country. And I think we now have the tools to do that, to really make tremendous progress. But you have the greatest credibility. And, poll after poll shows, I came back after the IRA passed. I was on the outside pushing for its passage while I was at the Center for American Progress. But poll after poll shows that the most credible people on the question of the benefits of reducing pollution, whether that's by regulation or through these investments in the IRA, are healthcare professionals. So make your voices strong, make them loud, directly with your with the patients that those of you who are interacting with, or your systems are interacting with, but also at the policy level.
Absolutely. And I think it's really been Ed Maibeck's research as well that's shown that that the health message is also what's very resonant across political lines. I wanted to return to one of your comments about community clinics and FQHCs. If folks can raise your hand in the room if you work for a community clinic or FQHC. Later today, we're actually going to have some discussion around using the IRA dollars for community clinics, just understanding that these are very important sites to keep the lights on, to keep the power going, but also because they provide lots of other resources to the community. Are there other nodes that we should be thinking about on a community level where we should be investing our resources, since we can't fit every home to be places of climate resilience? And to your point, there are some populations that are more vulnerable.
Look, I think what we're experiencing are more extremes. It's kind of cold outside, really, for March in Washington. The cherry blossoms are out, but it's still pretty, it was in the 20s yesterday. As the scientists in the room know, that actually is an effect of a changing climate, of loss of the polar vortex, blah, blah, blah. We can get into that. But the truth is, whether it's extreme storms and the effects of that, extreme heat, extreme cold, the frontline place where people go when they are in kind of extreme vulnerability are really to your healthcare operations, whether that's a clinic or a hospital. And so kind of climate proofing those places, making sure that you're thinking about whether they may be an important facility for cooling when it's superheated, or for people to get off the street and find some warmth when it's so cold, when they're having a hard time, particularly the heat stress on people is going to become a much more significant issue. And it's combined with other effects, increases in air pollution, ozone, et cetera. So the rates of respiratory disease will increase. But I think sort of thinking about those kind of facilities as community nodes for public health is just always critical. And whether that was as a place to provide vaccines and care during the pandemic, or when people are stressed because of the effects of weather, I mean, that's where people will go there and try to find relief from the superstorms, or from this extensive. California can't seem to go one way or the other. I mean, God, I have my wife and I, for reasons that have everything to do with our grandchildren, hadn't for a long time had a condo in Truckee. It's always bad when your vacation house is on the front page of the New York Times because of some weather disaster. So I was back here and under 10 feet of snow are these houses. So again, whether it's all these extreme weather stressors are going to come home to people. And I think planning for that, building out facilities to deal with that, having them being an oasis from that extreme pressure is going to be an important role that community health centers in particular are going to play.
Yeah, I actually live in the Bay Area, so that resonates with me. And some of the work that, because we've had wildfires and heat, there's been a lot of work on mapping places, and so schools has been another place that's been a big focus. As have public libraries, and churches have been just some places where people naturally gather, just in terms of places where we could really think about how to invest those dollars. Last night, we got to hear from Dr. White Newsom, who came and delivered some comments on Justice 40. And so I was wondering for your take, equity is central to our mission. We understand that those that are hit first and worst tend to be the ones that did not actually contribute significantly to the climate crisis. So when we think about the role health advocates can play to deliver on this, what would be your advice in terms of Justice 40?
Well, I think this was an extremely significant initiative that the president undertook right at the beginning of the administration. So beyond the bills, the big bills, the CHIPS and Science, the IRA, the ARP that passed early in the administration, I think what the president recognized and the administration recognized is that all federal funds that have an effect, particularly at the community level, should be reviewed to see if they are applicable to ensure that 40%, I'm sure she talked about this, 40% of the benefits reach communities that need the help the most, quite frankly. And often that's, that literal exercise has not been done. Monies flow out, particularly those that come through state formulas, et cetera, in a way that doesn't reach the most vulnerable and the intended recipients of many of those programs. And so this was an exercise in trying not only to map, but to orient decision makers towards this goal that 40% of the benefits reach disadvantaged communities. There's a CEQ and OMB house that effort. A significant part of that benefit really comes in the form of public health benefit from investments across a whole range of programs. And I think it's not been an easy exercise, but it's a crucial exercise to be able to try to drill down and create the both at the agency level, at the OMB and the all of government level, the dashboard to try to measure what the impact is. We often forget about that. It's kind of dollars in, dollars out, and we kind of forget that differentially. Look, we have before there was the IRA, there was a bill called Build Back Better, which sort of died 1,000 deaths, and finally we got the IRA, and we got some of the healthcare. Didn't get everything, but got the clean energy benefits and some of the healthcare changes that the president was pushing for in the IRA, along with substantial tax reform and actual inflation reduction by lowering the deficit. But Build Back Better was named for that because things weren't built with justice and equity always top of the mind. And rather than just replicating the advantages that certain communities had, and quite frankly, the injustice and advantages that communities, particularly environmental justice communities, had, you have to be top of the mind. Managers have to be thinking about that. Cabinet secretaries have to be committed to that, to make sure that in program design decisions that you're going to reach the affected communities. The other thing that really is quite challenging, I find this is one of the things that keeps me up at night on the IRA, is those are communities that often have the least social capital, the least ability to access federal funds, the least knowledge about how you get a grant. And so I think it's incumbent where it's lawful for the federal government. EPA is about to release a bunch of grants to re-granters to provide capacity building for organizations to be able to access funds like in the Justice 40 program. But I've been an advocate for having the philanthropic community try to tackle that problem as well and create mechanisms to support the technical assistance um, and the community assistance that people need just to be able to make a grant application, which is often the most challenging thing, I think, for communities that have very, very few resources, very low budgets in those communities, smattering of capacity amongst community-based organizations. So I think that both, and I think, again, this community can be very helpful in partnering to making sure that the benefits of what a grant could mean to a community are really made clear to people particularly in these competitive grant programs.
Oh, and it's something we've heard echoed repeatedly by our speakers is this deep concern that these dollars are really meant to help the communities that need the dollars the most, but often there's a capacity issue in the role we can play to try to bridge that gap. The last question I'll just ask you is just sort of advice to all of us. You've been working at this for a very long time. I'm sure you've seen all kinds of up, downs, and turnarounds. I remember I worked for the Environmental Protection Agency during an administration that did not believe climate change was happening. And a piece of advice that I got is that in federal government, sometimes it's 2 steps forward, 1 step back. Right now, maybe we're taking 5 steps back. But I'm just curious from your point of view, we don't know what's going to happen in 2 years or even 4 or 6. What advice do you have to all of us thinking about the long game in terms of climate health and equity?
Look, it is the profound reality facing the country and facing the globe. And, back to the justice point, often it's the great irony of climate change. The people that contribute the least get hit the hardest. And so this is going to only accelerate as the pace of change accelerates with respect to climate. I think we have the tools to be able to arrest the most catastrophic impacts, but make no mistake. I mean, this is going to have profound health effects, public health effects on water system, food security, et cetera, for generations to come. And it's why I think people need to be knowledgeable. They need to be articulating in that context. The one thing and I've been doing this for a long time, but the one thing I take some heart from is that it used to be that, people weren't, if you looked at the public data, there's definitely a partisan divide or a partisan tilt. But generally, people across the political spectrum in the U.S. Supported clean energy. They like that as part of this solution. Now I think there's a deeper understanding and more commitment to the idea that the world is changing, the weather's changing. We need to come to grips with it. There's less real climate denialism out there. So that's a change for the better. But the pace of it and the acceleration that we need to undertake, I like to quote those IPCC, the Intergovernmental Panel on Climate Change 1.5 report, which came out in 2018, which measured the delta between what a 1.5 world looked like and what a 2-degree global average temperature world looked like. That changed everything, really. That's where net zero came from. That's why people said, no, 80% reductions isn't enough. We need to really stabilize the atmosphere. The only way to do that, although if we could actually do it, would be to get to the point where we're taking as much climate pollution out of the atmosphere as we're putting back into it to get to that net zero point by mid-century. And the devastation to the natural world and therefore to human well-being is profound between those two things. But when you think about that, the fact that we need to do that in 30 years, 40 years, maybe, and we've kind of burned a lot of time making some progress, but not enough. They described that as a transformation of the global economy on a size and scale that's never occurred in human history. So that's our generational challenge, a transformation of the global economy on the size and scale that's never occurred in human history. That's both exciting and kind of scary, but I think we just got to stick with it. And I think you're on the front lines, you feel it every day. So, the only thing people ask me if I'm optimistic, and people tell me I'm supposed to say I'm optimistic. I don't know if I'm optimistic, but I know that you just got to stay in the fight. And if you do, that change can happen and good things can happen.
I think that's great advice. And I think many of us as healthcare workers, having gone through the pandemic, understand that sentiment as well. We have to stay in the fight. Absolutely. Thank you so much for your comments. And we really appreciate all the advice and insight.